I've lost half the hair on my head because I decreased my spironolactone dose. I have had cystic acne, especially hormonal acne, like pretty much all my life since my period started. It didn't matter how old I got, it never really went away, and my skin's so fragile, and I have dermatillomania, I tend to pick at it. So I've stayed on birth control for that, as well as a couple of years ago, I was put on spironolactone to help with the hormonal acne as well. And it did clear it up almost completely, except for like a couple days before my period would start. However, then I got COVID in October, but I was on 100 milligrams of it a day. I got COVID in October, and I got long COVID, and then I started having really bad POTS or dysautonomia flare-ups. I'm officially diagnosed with dysautonomia, but am pursuing a POTS diagnosis and have an appointment for cardiology just because I need one from having congenital heart disease in the first place. Anyways, so I learned that spironolactone, because of the way it works with your blood vessels, can make dysautonomia worse. So I contacted my doctor about getting off of it gradually because she told me I should not stop at cold turkey, especially with having issues with my blood pressure and my heart. So she told me to start cutting my dose in half. So I started taking about 50 milligrams in April. Other things that are important to know about me. I have fine hair, but I've always had so much of it. If you go look at my videos from like a year ago, I had so much hair. And I started taking 50 milligrams, so cutting my dose near the end of April. And I noticed like a week or so after, I started having a lot of shedding, especially in the shower. But to be honest, like I didn't think about it that much because I only wash my hair like a couple times a week. And I just thought that like maybe I was stressed. I had a lot of stuff going on in my personal life. So like maybe it was just that, and I was having a little bit more shedding than normal. But then the shedding didn't stop. And then it started coming out in like fistfuls when I would brush my hair. And now we're at the point where it is the thinnest it has ever been. And like, yes, I know I still have a significant amount of hair, but this is like, I used to have to use special hair ties because my hair, I had so much of it. And now I feel like I have so little and it's coming out so much, and it has me like so stressed and honestly like emotional. Like I didn't realize how much like my hair contributed to my self-worth to an extent, which is something I definitely need to unpack in therapy. But like it's just a symptom of all that's going on with me that I am not mentally prepared for. So I emailed my primary care doctor. Like I haven't heard back from them yet, but I was like researching on my own like stuff for hair loss because like it's still coming out. Like so much is coming out and has been for the past 2 months. My ponytail has at least halved in size. There are just several places now where like, especially if I pull my hair up, I have noticeable bald spots, and it's making me not want to wash my hair. It's making me feel afraid to even like brush it, or touch it. Like anytime I run my hands through my hair, like several strands of hair are coming out just every time. Even right now as I'm sitting here, I can feel strands of hair coming out onto my legs. So I'm just really confused because like I looked up spironolactone, and when you stop taking it, it can cause hair loss because a lot of people I guess get on it for hair loss, but I've never had an issue with my hair thinning, except for like pulling the hair out myself as like a nervous tick. But I have not had issues with like alopecia. I've not ever had thin hair. I've always had so much hair. And so I was just like not prepared for this side effect because my hair's always been so much thicker than it is right now. So my question is like, if you've had to get off of spironolactone, have you had a similar experience, even if you weren't on it for hair loss in the first place? And then if you get on another medication for hair loss, like I've looked up minoxidil, but I've heard that has similar effects for people that have Ehlers-Danlos syndrome, or POTS, that it can cause dysautonomia, and that it can also cause like flexibility of your blood vessels, which like obviously we don't want if you have a connective tissue disorder. Like, have you tried topical things before? Obviously like Nutrafol is the one that comes to mind that's the most advertised, but I haven't really looked into like how, like if there's really a lot of research behind it or if it's a scam or whatever. So like if there's anything you found that have worked for you, please give me tips because this has been really devastating and difficult for me. And I'm terrified that it's just going to keep getting worse until I have like essentially alopecia and large bald spots on my head. And I need a win. this year. And like, you may be watching this and thinking like, it's just hair, like it grows back, why it should grow back. Why is this such a big deal? And like in society, I think we put so much value on women, specifically what they look like in their hair. So it's something that I've always like kind of used to mask and hide behind, and now I have less of it and there's less for me to be able to hide behind, and I don't even feel like I can fidget with it anymore like I normally would. And I don't know if it's gonna come back. I can't find anything about the effects of like if the shedding ever stops, or if your hair will ever come back normal, because so many people seem to take it for hair loss in the first place. So and also I have an appointment that's coming up in like a month with a dermatologist, but I just can't wait that long. And that appointment isn't even for this. This is just now an additional issue that I'm facing. And I really don't want to have to go like back on spironolactone, or I'm not even off of it all the way either. So like I'm terrified now to keep reducing my dose. This is what happened when I just halved it. What if I have it again? Am I going to lose all my hair? It just really sucks. And it seems like something that's so small, but like I've had a lot of health issues, and like this is one thing I was not prepared for. And it's something that's like so stigmatized, not having hair. And I don't know, I feel like I'm trying to justify my feelings because I know that there are going to be people judging me in the comments, but this is really hard for me to share. So if you have tips or information, like please be gentle and encouraging with me. Thank you.